You had questions. The Fox 12 investigators went looking for answers. Tonight, in our ongoing series, answering your questions about COVID-19, a closer look at the benefits and costs of opening Oregon's economy.
Fox 12's Simon Gutierrez is live tonight in Northeast Portland with some answers. Simon?
Yeah, with hundreds of new cases of COVID-19 every day, some people are wondering, did Oregon open back up too quickly? And is it time to take a step back?
Judy in Happy Valley asks, why are we open and working when the numbers are so high? We were shut down when the numbers were lower than this.
There are economic and ultimately health consequences to being shut down. You know, we're very aware of the hardships that people endured by being out of work. And, you know, those of us in public health are also aware that sooner or later there are health consequences to being unemployed and to not having an income. We want to open up. It's a really important goal. We need to keep track of those numbers. I think sooner or later we will have to start closing down again if we don't see some improvement in those numbers. But that's why it's so important that we take, you know, all of those individual steps that we can take to stop transmission.
Some of the studies have suggested the idea of herd immunity is kind of a long shot with this particular virus. It seems like people are potentially susceptible even after they've had it.
One of the things that we don't know really well, I don't think there are enough data to say whether or not immunity lasts very long afterwards. I do think we know that at least for a short period of time after you've been infected, that you're probably not susceptible to a reinfection very quickly. And I say that because almost everybody within 3 weeks of getting sick is going to produce antibodies that will neutralize the virus. Now, how long those antibodies stay at sufficiently high levels within you is an open question.
Of course, Simon, we talk about the number of cases, but we've also heard in other states of hospital capacity that's also important, especially when it comes to an issue along with the spike in cases we're seeing. So how are we looking here in Oregon?
Yeah, according to the health authority, which tracks this closely, hospitalizations here in Oregon have been going up for the last 5 weeks, but are still below the levels where they were in March and April. And right now, there are 51 patients hospitalized with COVID-19 in intensive care in Oregon right now, and there are 125 available adult ICU beds. We do have another question to get to tonight, coming up at 6. When will all of this go back to normal? We'll see you then.